What if everything you believed about how much you need to exercise was wrong? What if the hours you thought you needed could actually be cut down to a fraction? Today we're looking at surprising new research that challenges the more is better exercise mentality and reveals how strategic, efficient workouts may deliver better results than grinding through hours at the gym. This is Better Health Faster, where we translate the latest health science into practical strategies you can actually use. I'm glad you're here. Here's a question that might surprise you. Would you believe that 2 workouts per week, totaling just 60 to 90 minutes, could be enough to see significant health improvements? Or that mixing up your activities, walking one day, lifting another, maybe some gardening, might matter more for longevity than how long you spend doing any single exercise? A massive Harvard study following over 111,000 people for more than 30 years just gave us some answers, and they challenge a lot of what we've been told about exercise. Let's start with a familiar story. You decide to get in shape. You sign up for a gym membership. You tell yourself you'll go 5 days a week. And for a week, maybe 2, you do. But life happens. Work gets busy. You miss a day, then another. The guilt builds up. Eventually, you stop going altogether. If you can't do it right, 5 days, an hour each, why bother doing it at all? This all-or-nothing thinking keeps millions of people sedentary. The belief that meaningful exercise requires serious time commitment becomes a barrier to doing anything at all. But what if the science told a different story? What if the minimum effective dose was far lower than we thought, and far more achievable? The concept of minimum effective dose comes from pharmacology. It's the smallest amount of a substance that produces a desired outcome. Too little, no effect. But you don't always need more. Exercise scientists have been asking, what's the minimum dose of physical activity that actually moves the needle on health? The answers are genuinely encouraging. Brad Schoenfeld, a leading exercise scientist, told NPR in January 2026 that 2 workouts per week, totaling 60 to 90 minutes, can produce very good gains and benefits on all health markers. That's not a typo. 2 workouts. 60 to 90 minutes total for the entire week. Not per day, per week. This challenges decades of messaging that more is always better, that you need to push harder and longer to see results. But here's what makes the Harvard study particularly compelling. It wasn't just about how much you exercise. It was about how many different ways you move your body. Researchers followed over 111,000 adults for more than 30 years through the Nurses' Health Study and Health Professionals' Follow-Up Study. They tracked not just total exercise time, but the variety of activities people engaged in: walking, running, swimming, cycling, strength training, and more. The finding that stood out: people who engaged in the highest variety of exercises had a 19% lower risk of premature death compared to those with the lowest variety. 19% lower mortality risk. That's a substantial difference. And it wasn't just about total exercise volume. Perhaps most importantly, this relationship between exercise variety and lower mortality held true at every level of physical activity. Whether you exercised a little or a lot, variety still mattered. This means variety contributed to longevity regardless of total exercise time. Even modest exercisers benefited from mixing things up. The Harvard researchers put it clearly. When deciding how to exercise, people should keep in mind that there may be extra health benefits to engaging in multiple types of physical activity. But what specific activities showed the strongest benefits? The data revealed something interesting about an exercise we often undervalue: Walking vigorously was linked to the highest reduction in early death risk at 17%, more than any other single activity studied. Running showed a 13% reduction. Climbing stairs, something most of us can do anywhere, showed 10%. Resistance training came in at 9%. Notice something about that list. Walking, the simplest, most accessible form of exercise, topped the chart. You don't need special equipment or a gym membership. Some skeptics might wonder, does your body really benefit from small amounts of exercise, or does it somehow compensate by reducing energy expenditure elsewhere? This was a real concern in exercise science. The constrained energy hypothesis suggested that the body might adapt to exercise by reducing other activity, minimizing the net benefit. But a Virginia Tech study published in PNAS in December 2025 debunked this myth. Physical activity truly increases total daily energy expenditure. Your body doesn't cancel out your workout. This means every bit of exercise you do genuinely counts. Your body isn't secretly working against you. It's building on each effort you make. Even minimal training shows measurable results. Research following nearly 15,000 people for up to 7 years found that those training just once weekly for 20 minutes got 30 to 50% stronger. 30 to 50% stronger from one 20-minute session per week. That's not optimal for building maximum muscle, but it's far from nothing. So why does variety seem to matter so much for longevity? The researchers have several theories that make biological sense. Different activities challenge different muscle groups and movement patterns. Running works your cardiovascular system one way, swimming works it differently. Strength training builds capacity that walking alone cannot. Variety may also help prevent overuse injuries. When you repeat the same motion patterns constantly, you stress the same joints and tendons. Mixing activities gives different tissues time to recover. There's also the psychological component. Doing the same workout every day can lead to boredom and burnout. Variety keeps exercise interesting and sustainable over the long term. Some important caveats. This research shows that minimal exercise provides real benefits. But it doesn't say minimal is optimal for everyone. If you're training for a marathon or trying to build significant muscle mass, you'll likely need more volume. The minimum effective dose is about maintaining health, not maximizing athletic performance. And while the variety finding is compelling, researchers acknowledge they couldn't fully account for whether people who do varied exercise are simply more health conscious overall. So how do you apply this research to your own life? Let's talk about practical strategies. But remember, always consult your doctor before making significant changes to your exercise routine. First, if you're currently not exercising at all, start with just 2 sessions per week, totaling 60 to 90 minutes. This is enough to begin seeing meaningful health benefits. Don't aim for perfection out of the gate. The goal is consistency, not intensity. 2 manageable sessions beats 5 ambitious ones you'll abandon by week 3. Second, prioritize variety over repetition. Rather than doing the same workout twice a week, mix activities. Walk one day, do strength training another. The Harvard research suggests this variety may be as important as total exercise time. Think of it as a portfolio approach. Diversification protects your investment. Third, don't underestimate walking. It showed the single highest mortality reduction in the Harvard study. A brisk 30-minute walk is genuinely powerful medicine. You don't need a treadmill or special gear. Just step outside and move with purpose. If you can talk but not sing, you're at the right intensity. Fourth, consider exercise snacking. Brief bursts of activity throughout the day. Taking stairs, parking farther away, a few squats between meetings. Add variety without requiring dedicated gym time. These micro workouts count. They add to your weekly total and introduce variety naturally. The body doesn't care whether exercise comes in one block or many small pieces. Fifth, think in terms of movement patterns rather than specific exercises. Can you push, pull, squat, hinge, and carry? Can you move in different planes? Forward, sideways, rotationally. This approach naturally creates variety. One day you might walk and do push-ups. Another day, climb stairs and carry groceries. You're training your body to be capable in multiple ways. Sixth, remove the mental barriers. We often think exercise only counts if we're sweating in a gym. The research says otherwise. Gardening, dancing, playing with kids, cleaning the house vigorously. These all contribute. The study counted diverse activities, not just traditional workouts. Remember, the relationship between variety and longevity held true at every activity level. Whether you're exercising 30 minutes a week or 5 hours, mixing it up still helps. Seventh, be patient with progress. The benefits of exercise accumulate over time. The Harvard study followed people for over 30 years. Health is a long game. The goal isn't to transform your body in 30 days. It's to build sustainable habits that serve you for decades. Small, consistent efforts compound into significant results. And here's encouraging news. Your efforts aren't being wasted. The Virginia Tech research confirms your body doesn't compensate by reducing other activity. Every workout genuinely adds to your total. Some of you might be thinking, this sounds too good to be true. 2 workouts a week? Variety more important than volume? What's the catch? The catch is that this research describes minimum effective doses for general health, not optimal approaches for specific goals. If you want to run a fast marathon, you'll need to run a lot. If you want to build significant muscle, you'll need more training volume. The minimum dose keeps you healthy. Targeted training optimizes specific capacities. But for the millions of people who exercise 0 minutes per week because they feel they can't commit enough time, this research offers real hope. The biggest difference isn't between 90 minutes and 5 hours of weekly exercise. Research consistently shows the biggest jump in benefits comes from going from 0 to some. So if you've been waiting for enough free time to exercise properly, consider this your permission slip to start small. 2 sessions. 60 minutes total. Multiple activities. That's not settling for less. That's respecting the science. The research suggests this approach may serve your long-term health better than ambitious programs you can't maintain. Let's bring this together. A 2026 Harvard study of over 111,000 adults found that exercise variety, not just total time, predicts longevity, with diverse activities linked to 19% lower mortality. Exercise scientists now recommend 2 workouts totaling 60 to 90 minutes weekly as an effective minimum dose, and your body doesn't compensate for exercise. Every bit genuinely counts. Walk briskly. It showed the highest mortality reduction. Add strength training. Climb stairs. Mix it up. The variety itself may be part of the medicine. This content is for informational purposes only and is not a substitute for professional medical advice. Always consult your doctor before making changes to your health routine. Thanks for spending these minutes with me. If this episode helped you think differently about exercise, I'd love for you to share it with someone who might benefit. Until next time, here's to better health, faster.